The therapist I chose to interview was Les Gordon. He has a master's degree at Bradley University, where he was a Merle Kaufman Scholar and was awarded the Outstanding Achievement in College of Education. He did additional grad work at Nova Southeastern University and has attended and or facilitated many seminars. The area of study he focused on was speech and hearing sciences, learning disabilities, counseling psychology, marriage and family therapy, and human sexuality. He deals with issues of ADHD, anger management, anxiety, codependency, divorce, emotional disturbance, family conflict, grief, internet addiction, learning disabilities, life coaching, OCD, relationship issues, sex therapy, transgender issues, trauma, and PTSD. Mental health issues of impulse control disorder and mood disorders also. He has specialties in child or adolescent parenting and depression. I chose to interview this therapist because I have worked personally with him and my family. He also used to work at North Broward, and I have known him for a little and could get an appointment with him easily, which is not easy with a therapist. I went to his office in Boca Raton, where we casually sat in his office like a normal meeting. I went in the afternoon around 5 p.m., and his office was very home-like and comfortable. It made it especially easy to open up and feel like I was in a safe space. The walls and shelves are covered in plaques, books, notes, letters, and pictures of family also. With this interview, I wanted to find out more about real-life details about what it's like to be a therapist. I learned about different methods he used and how he applies them in his therapy sessions. I learned about the different therapies he practices and how they differ, and the treatments that differ for each. For the interview, he asked that I not video record him, but audio record him. So the next clips are going to be from the interviews. Why did you become a therapist?
Well, initially I was a special education teacher, and I needed to be able to do more for clients, so I was interested in psychology. So I went back to school in psychology, counseling psychology, and got licensed in it. I was always some sort of a person who wanted to help people. Originally I did speech and language therapy, and then learning disabilities and special education, and then counseling.
Okay. What are your degrees in?
I have a bachelor's degree in speech and hearing sciences, a master's degree in learning disabilities, and postgraduate hours in counseling psychology.
What is your experience and how long have you been a therapist?
I've been a therapist in private practice for over 30 years. And my experience is varied. I was the director of a child and adolescent psychiatric hospital program for 4 years. And then I was a consultant to another adolescent inpatient treatment program. And then in and out of private practice. I was also the assistant headmaster at North Broward Preparatory School for 8 years and running their learning disabilities program there. So I've been in and out of education and psychology.
Okay, how would you describe your treatment style?
It's eclectic, which means that I utilize a number of different approaches depending on what the client needs. So one of them would be CBT, or cognitive behavioral therapy. Another would be reality therapy by William Glasser. And then I'm also a trained clinical hypnotherapist, so I can use that as well.
What kind of evaluation process do you use to recommend a treatment plan?
I do an intake. Since I see mostly children and adolescents, oftentimes they come with a psychoeducational report with recommendations. If not, I do some assessment through interviewing and observation, and some informal tests like depression, anxiety, loneliness, that sort of thing, to find a baseline for where they're at and what they want.
Okay. What are the measurable criteria you use to assess how well treatment is working, and can you give a few examples?
Well, whatever like tests of depression or anxiety or loneliness or obsessive compulsive disorder that I give in the beginning, I repeat again in 3 months so that we can see how we're doing. And the second part of that is patient reporting.
Okay. What psychotherapeutic approaches and tools do you use?
I use play therapy. I use cognitive behavioral therapy, reality therapy. Um, I'm also, and sometimes clinical hypnotherapy. I'm also a board certified sexologist, so I am able to work with people who have sexual dysfunctions or other types of issues related to that.
Okay. What is your availability in an emergency, and if you're not available, what are alternatives?
Well, I have my phone, my cell phone, which all my clients have, and I'm available pretty much 24 hours a day, 7 days a week. Of course, it has a message that every psychologist has, which is if this is an emergency, please hang up and dial 911 or present yourself to emergency room.
What specific goals will be set for treatment, and how will they be communicated?
Well, on the initial intake, the client states what their purpose for coming to counseling is. So there's certain conditions I don't treat. I don't treat addictions. I don't treat gerontology, which is older people. Although I'll be an older person soon. And I just go off of what their needs are and see if I can meet them. And if for some reason, after 3 or 4 sessions, they don't seem to be comfortable with me, or if I'm uncomfortable with them, we'll talk about it and perhaps I'll refer them to other people.
How long will the treatment process take, and how do you know when recovery is happening and therapy can stop?
Well, with children and adolescents, when the symptoms that they presented are decreased, if they're having conflict with peers, if they're having temper tantrums, if they have attention deficit disorder, if they have school-related difficulties, after things have improved by reported parents, teachers, and by the client, I go to every 2 weeks. And if things are maintained, I'll go to every month, and then on an as-needed basis.
Okay. From this interview with the therapist Les Gordon, I learned a lot of things about how he incorporates different techniques and how he uses each to, how he applies each of them to his different therapy styles or the different things he needs to treat. And I also learned that he uses some of the main concepts that we have studied in psychology, like cognitive behavioral therapy is one that he mentioned in one of his questions. He also discussed how he treats coexisting mental issues like depression and anxiety, or somebody with anxiety and something else, or how things like depression can affect relationships. And he explained how he helps patients either overcome these issues or treats these issues with patients, and if he does treat these patients, how he uses his tools as a psychologist.